Hi, welcome to my channel. Subscribe or like if you like it. Today we are going to talk about the active principle Tocilizumab. We will answer to, what is Tocilizumab? And what is Tocilizumab for? We will also explain its mechanism of action, side effects, dosage, uses, contraindications, warnings, pregnancy and indications. The trade names of Tocilizumab are, Actemra and Actemra. Mechanism of action of Tocilizumab. It binds to both soluble and membrane-bound IL-6 receptors, IL-RS6 and IL-RM, and inhibits signaling mediated by both. Therapeutic indications of Tocilizumab. In combination with methotrexate, MTX, 4. Treatment of severe, active and progressive rheumatoid arthritis, RA, in adults not previously treated with MTX. Treatment of moderate to severe active rheumatoid arthritis in adults with inadequate response or intolerance to previous treatment with one or more disease-modifying anti-rheumatic drugs, DMARDs, or tumor necrosis factor, TNF, antagonists. It may be given as a monotherapy in case of MTX intolerance or when continued treatment with MTX is inadequate. Treatment of active juvenile systemic idiopathic arthritis, JIA, from 1 year to older, who have not responded adequately to previous therapies with NSAIDs and systemic steroids. It can be administered as monotherapy, in case of MTX intolerance or when MTX treatment is not suitable, or in combination with MTX. In combination with MTX it is indicated for the treatment of juvenile idiopathic polyarticular arthritis, JIP, positive or negative rheumatoid factor and extended oligoarthritis, from 2 years of age and older, which have not responded adequately to previous treatment with MTX. It may be given as a monotherapy in case of MTX intolerance or when continued treatment with MTX is not appropriate. Treatment of giant cell arteritis, GCA, in adults. Treatment of severe or life-threatening cytokine release syndrome induced by chimeric T-cell antigen receptor, in adults and in pediatric population 2 years of age and older. Dosage of Tocilizumab. Intravenous perfusion. Rheumatoid arthritis, 8 mg/kg, 1 time every 4 weeks. For body weight greater than 100 kg do not exceed 800 mg. Doses higher than 1.2 grams have not been evaluated. Dose adjustments according to liver enzymes. Neutrophil count, RAN, cells x10-9/L. Platelet count, cells x10-3/MCL. Cytokine release syndrome, adult and pediatric population, for body weight of 30 kg or more, 8 mg/kg. For body weight under 30 kg, 12 mg/kg. Administer alone or in combination with steroids. If there is no clinical improvement of signs and symptoms after the first dose, up to 3 additional doses can be administered, with an interval between consecutive doses of at least 8 hours. Doses higher than 800 mg are not recommended for perfusion. Systemic juvenile idiopathic arthritis, safety in children under 2 years old has not been established. Children over 2 years old, recommended dose, 8 mg/kg, 1 time every 2 weeks or 12 mg/kg, 1 time every 2 weeks. Polyarticular juvenile idiopathic arthritis, JIA, safety in children under 2 years of age has not been established. Children over 2 years old, recommended dose, 8 mg/kg, 1 time every 4 weeks or 10 mg/kg, 1 time every 4 weeks. In both cases dose adjustment depending on liver enzymes. Neutrophil count, RAN, cells x10-9/L. Platelet count, cells x10-3/MCL. Subcutaneous. Treatment of severe, active, progressive rheumatoid arthritis in adults not previously treated with MTX and treatment of moderate to severe active rheumatoid arthritis in adults with inadequate response or intolerance to previous treatment with one or more FAMs or tumor necrosis factor, TNF, antagonists, 162 mg 1 time per week. Treatment of adult skin cell arteritis, 162 mg once weekly in combination with a gradual reduction of glucocorticoids. It can be used in monotherapy after suspension of glucocorticoids. In monotherapy, it should not be used for treatment of acute relapses. Dose adjustment as a function of liver enzymes, platelet count, cells x10-3/mcl. Treatment of systemic juvenile idiopathic arthritis, JIA, active from 1 year to older, which has not responded adequately to previous therapies with NSAIDs and systemic steroids. Children with body weight greater than or equal to 30 kg, recommended dose 162 mg once a week. With body weight less than 30 kg, 162 mg every 2 weeks. Treatment of juvenile polyarticular idiopathic arthritis, JIP, positive or negative rheumatoid factor and extended oligoarthritis, from 2 years of age onwards, which have not responded adequately to previous treatment with MTX. Children weighing 30 kg or more, 162 mg once every 2 weeks. Children weighing less than 30 kg, 162 mg once every 3 weeks. Tonsillizumab administration mode: intravenous. After dilution, it should be administered as an intravenous infusion for 1 hour for both RA and IS patients and for I patients. Patients with RA, IS and I weighing 30 kg or more. Dilute to a final volume of 100 ml with a solution for sterile injection, epirogenic sodium chloride, 9 mg/ml, 0.9%, by aseptic technique. Patients with IS and I weighing less than 30 kg. Dilute to a final volume of 50 ml with a solution for sterile injection, epirogenic sodium chloride, 9 mg/ml, 0.9%, by aseptic technique. Subcutaneous. Administer the entire contents, 0.9 ml, of the pre-filled syringe as a subcutaneous injection. The recommended areas for injection, abdomen, thighs and upper arm, should be alternated and the injection should never be administered in moles, scars, or in areas where the skin is sensitive, bruised, red, hard or not intact. Contraindications of Tocilizumab: hypersensitivity to Tocilizumab, severe and active infections. Warnings and precautions of Tocilizumab: moderate to severe kidney failure, history of recurrent or chronic infection, history of recurrent or chronic infection or underlying processes, diverticulitis, diabetes, interstitial lung disease, latent tuberculosis, must receive antimycobacterial DO. Before starting. History of intestinal ulceration or diverticulitis. Assess an active liver disease or liver failure, elevation of transaminases greater than 1.5 LSN, low neutrophil or platelet count. Not recommended with ALT or AST greater than 5 LSN at baseline or with absolute neutrophil count less than 0.5 by 10^9/L or platelet count less than 50 by 10^3/MCL. Monitor transaminase values, 4 to 8 weeks for the first 6 months and then every 12 weeks. In IS and I monitor ALT and AST in second and subsequent perfusion. Neutrophil and platelet count or evaluation of lipid parameters, 4 to 8 weeks after start, in IS and I monitor in second and following perfusion. Do not administer with live or live attenuated vaccines. No experience with TNF antagonists or other biological treatments. Use contraceptive measures, during and up to 6 months after treatment. Not recommended for children under 18 years old. Risk of viral reactivation, and risk of hypersensitivity reactions associated with perfusion. Risk of central demyelinating disorders of new appearance. The risk of malignant tumors is increased in rheumatoid arthritis. Immunomodulatory drugs may increase the risk of malignant tumors. With rheumatoid arthritis there is increased risk of cardiovascular disorders and need to have their risk factors, for example, hypertension, hyperlipidemia, treated as part of regular care. Risk, rare, of severe liver damage, including acute liver failure requiring transplantation. Recommended for healthcare professionals. Advise patients to seek immediate medical attention if they experience signs and symptoms suggestive of liver damage. Monitor alanine aminotransferase, ALT, and aspartate aminotransferase, AST, levels every 4 to 8 weeks for the first 6 months of treatment, and every 12 weeks thereafter. Caution should be used if tocilizumab treatment is considered in patients with ALT or AST values greater than 1.5 times the upper limit of normal, LSN. Treatment with tocilizumab is not recommended in patients with ALT or AST values greater than 5 times the LSN. Assess dose changes, reduction, interruption or discontinuation, upon detection of abnormal liver enzyme levels. Liver failure in Tocilizumab. Caution, not studied. May be associated with elevated transaminases, especially with methotrexate. Dose adjustments based on liver enzymes, values higher than 1 to 3x LSN, modify methotrexate dose, and if the increase continues within this range, reduce to 4 mg/kg or discontinue until ALT or AST values become normal, then restore with 4 or 8 mg/kg, as clinically appropriate. Values greater than 3 to 5x LSN, discontinue until values found are less than 3x LSN, then restart with 4 or 8 mg/kg. If values greater than 3x LSN continue, discontinue treatment. Values greater than 5x LSN, stop treatment. Renal failure in Tocilizumab. Caution. It has not been studied in moderate to severe renal failure. Interactions with Tocilizumab. Monitor with substances that are metabolized by CYP4503A4, 1A2, 2C9, or C19, for example, atorvastatin, CA channel antagonists, theophylline, warfarin, phenytoin, cyclosporin, or benzodiazepines. Dose escalation may be necessary. Pregnancy in Tocilizumab. There is insufficient data on the use of Tocilizumab in pregnant women. One animal study has shown an increased risk of miscarriage or embryo-fetal death at a high dose. The potential risk in humans is unknown. Women of childbearing age should use effective contraception during and up to 6 months after treatment. Tocilizumab should not be used during pregnancy unless clearly needed. Women of childbearing age should use effective contraception during and up to 3 months after treatment. Breastfeeding Antociliuzumab. It is not known whether Tocilizumab is excreted in human breast milk. The excretion of Tocilizumab in milk has not been studied in animals. A decision about whether to continue/suspend breastfeeding or treatment with Tocilizumab should be made based on the benefit of breastfeeding to the child and the benefit of treatment to the woman. Effects on the ability to drive with Tocilizumab. The influence on the ability to drive and use machines is small. Side effects and adverse reactions of Tocilizumab. Upper respiratory tract infection, nasopharyngitis, cellulitis, pneumonia, oral herpes simplex, herpes zoster, abdominal pain, oral ulceration, gastritis, rash, itching, hives, headache, dizziness, elevated liver transaminases, weight gain, elevated total bilirubin, ETS, leukopenia, neutropenia, hypofibrinogenemia, hypercholesterolemia, conjunctivitis, peripheral edema, hypersensitivity reactions, cough, dyspnea, nausea, diarrhea. Start speech, end speech.